Hi everyone, this is Sean with the MassSupport Network here with the Public Health Report for Friday, February 5th, 2021. So things are continuing to trend downwards in Massachusetts. There's estimated to be about 61,000 or so circulating cases in the state right now, which is down from 78,000 estimated last week. In terms of people in quarantine, last week there were 22,000 people in quarantine. These are people who are generally waiting for test results. It's down to just 20,000. So a little bit less, not a huge drop off, but again, these are people who are either waiting for test results or perhaps are quarantined because of travel. They're not necessarily active tests, so these are not going to decline the same way that isolations will when cases trend downwards. Case in point, last week we saw about 80,000 people in isolation. These are people with actual positive COVID diagnoses. This week it was down to 64,000. Still a lot of people, but a drastic reduction from last week. In terms of the people who are being infected right now, you can see just about every age group has decreased from last week. Again, though, it's still the largest group with positive cases is still people younger than 20. And part of this may be due to some increased testing in that group because previously we didn't really test children very much or teenagers, but that's still a source of spread. Again, though, less than last week. The average age of total cases is 68, and the average age of deaths is 80, holding more or less steady from where those were last week. And in terms of our hospitals, well, we had about 300 fewer people in hospitals for COVID-19 than last week. Also reductions across the board here, over 100 fewer people in the ICU and nearly 50 fewer people on ventilators. So a lot of hospital resources being freed up in the last week, which is great news. In terms of testing, getting slightly faster, just from 1.92 days for a test sample to get processed and reported to the Department of Public Health, down to 1.90. So that's shaving off a couple of minutes there, slightly faster. And looking in terms of contact tracing, it's going a little bit slower in the last week, but more people completed in the first day, so faster and slower at the same time there. 72% of case outreach was completed within 1 day previous week, and then up to 78 the next week. These are, of course, much more, a little bit further behind the rest of the numbers here. Everything's kind of about a week behind here, so we may see this pick up next week. Looking at case counts or incidence rates around the state, this is the average number of new cases per 100,000 people over the last 14 days. And last week, that was 59.4, so about 10 fewer cases per 100,000 people per day in the last 2 weeks. And that decrease has been pretty steady across the state. Almost every county saw a decrease of about 10 cases per day, which is not as big the jumps as we saw last week, but a steady decrease. The only places that haven't jumped quite that far are the smaller counties, which the numbers are not going to be as flexible there. Franklin County and Dukes and Nantucket did not see quite as much decrease, but again, with populations that size, they're not going to change as much, but some significant decreases in the eastern part of the state. These are half as much as they were at the beginning of January. Finishing up, we'll look at the percent positivity, how that's changed, and you can see that's just drastically come down since the beginning of the year, down to just 3.3% there when you count in higher education testing, which is pretty good, and down to 5.2% when you count just the state as a whole, subtracting the screening testing done at higher education facilities, which tends to make the numbers look artificially lower. 5.2% is almost good. You want to be below 5%. We're almost there, and that is great. So we've got to keep at it. We don't want to let up because with those variants out there, things could easily turn back around, but hopefully next couple of weeks we'll really start to get back down to where we were in the early fall. As you can see from this chart, last time we were at this level was about in November, basically, and again, push that just a little bit further. We can get back to where things were in the fall, where things kind of felt okay in Massachusetts, comparatively at least. All right, and one last thought as we go into the weekend. It's going to be a little bit of a complicated one. This is a chart of the vaccine results in Israel. Israel is far and away the country that has given the most vaccine by population, giving large percentages of its population, and we're starting to see the effects on transmission and on illness. So the bottom two show the percentage of the population who's received vaccines. So on the left here, we have people aged 40 to 60, and on the right, we have people aged 60 plus. So as you can see, they prioritized people 60 plus, as people are, and got them released up. So around where this line is here, is where they hit about 70% of those 60 plus were have at least one dose there. When you look at these case lines, the blue lines are the 60 plus population there. So you can see the younger population cases, everything sort of trended down a little while after they started their third lockdown line here. But cases dropped much further with the older population. Hospitalizations dropped significantly. And severe and moderate hospitalizations, just any of the higher, also was a significant drop off there in the population that had been vaccinated more. So besides the fact that just this population going into the hospital a lot less, there also seems to be fewer cases in them too. So that is very encouraging there about what the vaccine can do when we really get it to enough people. So a bit of hope there for your weekend. And for more from the MassSupport Network, if you're looking for even more hope, you can find us on social media or on our website. And remember, wear your mask, wash your hands, and we'll be there if you need us. Stay safe.